Good afternoon, everybody, and thank you so much for joining us for another one of our short Meet the Specialist seminars. And today we have the very lovely orthopaedic surgeon, Dr. Sherif Rizkallah, with us. As you can see, he's actually in his car because he's had a bit of an emergency happen, as does happen to doctors, and so he's dashing off to save the day. But he has graciously given us a short amount of his time so that you can get to know him and a little bit more about him so that you can work with him and book IMEs with him. Dr. Rizkallah has been with MAG for a little while now. He writes an excellent report. He is available to book through our CowerCon platform or by calling our team. So that our people can know a little bit more about you. Over to you, Doctor. Tell us a bit about yourself.
Thank you very much, Michelle. Very excited to actually work with you guys. I've been doing orthopedics for 35 years now. I'm, originally Egyptian, born in Egypt, and migrated to Australia with my family when I was about 32. Did initial orthopedic training in Egypt and redid it again here in Australia. So I trained twice. Yeah, I've married, got a family, 4 kids. With the medico-legal work, I've been involved in the other end of that environment for many, many years, and I could really see that there's a lot to be said and done and made, etc., in the medico-legal field. So when I'm starting now to wind down my clinical practice to some extent, I thought we'll maybe get into medical legal because to me it is very, very interesting, and I believe that the knowledge and expertise that I've had through my working life hopefully will be helpful for people. Yeah.
So, Doctor, you're mostly, you are accredited in general orthopedics, so all body parts, but you have a particular expertise in complex shoulder surgeries and also hip and knees. Is that correct?
Correct. So I don't do backs at all, so no spinal surgery. I don't do pediatric orthopedics, but other than that, I do all sort of joint replacements, arthroscopic work, sports injuries, trauma. But yeah, knee, hip, shoulder, feet and hands as well. But yeah, sort of old style orthopedic surgeon.
Fantastic. So with a report turnaround, sir, what roughly would be your report turnaround once you've seen a person and assessed them?
If I've seen already the patient, probably 24 hours will be ready, because I wanna do it straight away before I forget, and I don't like
Well, it's
relying
still fresh in your mind, I think, is the politically correct way to say it.
Correct. Yeah, so I have all the information. I've seen the patient. I'll do the report straight away. So I'd
That's
say
actually great news. Yeah, many of our clients really like to hear that kind of speedy turnaround. So that's awesome. All right. And is there anything else that you would like our clients to know about you in terms of working with you?
yeah, I'm actually available most of the time. Really, any time is okay, and yeah, it's just whatever people wanna ask about or whatever. I'm more than happy to informally talk to people and discuss things beforehand, before we get too deep in the ocean. Yeah. But
2 quick questions before I let you go, sir. Are you able to assess via video link for any types of assessments?
oh, definitely, yes, definitely, yeah. No problem at all.
That's good. Obviously, it's ideal to assess face-to-face in most instances, but sometimes when people can't travel, that can be a factor. My next question is, would you ever do medical negligence matters?
Yeah, I would, but I would, really want to make sure before we start that, there is unequivocal evidence that there is a negligence, etc. It's not like something people like to do, but we have to do it sometimes. Yeah.
Of course, of course. Well,
Oh,
look,
yeah.
sir, thank you so much for your time today. It's been really great. This little capsule to get to know Dr. Sherif Rizkallah, orthopedic surgeon, and I thank you very much for your time. Have a great rest of the day and a good weekend.
Thank you very much, Michelle, and we'll be in touch very soon.
Absolutely. Take care. Thank you so much.
Thank you, everybody.